Top of the hour, you are listening to your number one family radio, and you know when you hear that tune, it is time for surviving sickle cell. It's a show brought to you by Sickle Cell Foundation Nigeria, and of course yours truly, your very own family radio, Inspiration FM 92.3. This is episode 178, and we're going to be having a conversation today as regards the organs at risk in persons with sickle cell disorder. Of course, our guest today is a retired director of nursing, Nigeria Ports Authority, Lagos, and now the head of Department Genetic Counseling, Sickle Cell Foundation Nigeria. She's also a lead genetic counseling trainer for counselors all over Africa. She goes by the name Mrs. Ayo Otaigbe, and she's going to be on the show with me from now till 12 o'clock. Good morning to you, ma. Good morning. Hello.
Hello, I'm listening.
All right, can you hear me now? Good morning.
I can hear you.
Loud and clear. All right, please, I'd like that you speak up a little bit so that, you know, everybody in Lagos can hear you loud and clear today. I like that you speak a little bit louder so that people can hear you loud and clear. All right, so we're going to be having a conversation today about the organs at risk in persons with sickle cell. This
is very faint.
Oh, it's very faint. Maybe what we'll try to do is try to, get in touch with you again, and maybe it will be better by that moment. Okay, just stay on the line. All right, we have her back on the phone line this morning. Good morning, ma.
Good morning.
Yeah, it's better now. This is beautiful. So we're going to be having a conversation about organs at risk in persons with sickle cell disorder. Let's dive right into it.
Organs at risk in persons with sickle cell disorder.
Yes.
Can I continue?
Yes, you can. You can.
Okay. Yes, organs are at risk in all persons, whatever their hemoglobin genotype, for reasons that are not always clear. It is true that persons with sickle cell disorder have more organs at risk than persons without sickle cell disorder. But I've also known some people who are professionals over 60 years old with sickle cell anemia, that is HBSS, and they are still living healthy, productive life. And I've also known some people who don't have sickle cell disorder and yet died at younger ages, either with cancer or with kidney disease. Although on the whole, people with sickle cell disorder have more organs at risk. So I will start with the blood vessels, the red blood cells, I mean.
Okay.
Persons with sickle cell disorder, especially those with sickle cell anemia, HBSS, sickle cell anemia, they have persistent anemia. The anemia, that is shortage of blood, the anemia varies from moderate to severe. Anemia occurs because the red blood cells containing hemoglobin SS have very short lifespan. The normal red blood cells lives for about 90 to 120 days, those who don't have sickle cell disorder, before they are broken down and fresh ones are made in the red bone marrow. But those with sickle cell, like especially hemoglobin SS, their red blood cells only live between 10 to 20 days. So they are frequently broken down. Because of this, they have consequent anemia. And this anemia they have is lifelong, and it reduces the ability to convey the extra oxygen required to effectively participate in competitive sporting activities, because oxygen gives us energy. When people are running a race, they breathe in faster to take in enough oxygen so that they will have the strength to complete the strenuous exercise. So it is very, very important. So, but because of shortage of oxygen, these people with sickle cell disorder, they cannot effectively participate in competitive sporting activities. But the fortunate thing is that it does not affect the oxygen required in the brain. Hence, persons with sickle cell disorder are able to succeed academically and distinguish themselves in various professionals. Thank God for that. Okay. Now, I'm going to the lungs. The lungs can be seriously affected in persons with sickle cell disorder by a condition known as pulmonary hypertension. This happens when the pressure in the blood vessels, that is the arteries in the lungs, when the pressure in the arteries in the lungs become higher than normal. And you know, when the lungs is not healthy, the person will not be able to breathe well. He can't even take part in anything. Clinically, the person is very ill. He has difficulties in doing anything, and it can lead to death if care is not taken. It's fatal. Now, I'm going to priapism now. What is priapism? I know I've discussed this very widely before.
Yes.
Priapism is a prolonged, unwanted, and usually painful erection of the penis. It's prolonged, it's unwanted, it's very painful. It may be short-lasting, that is minor priapism. Minor priapism lasts for less than 4 hours, or it may last for longer hours and even several days. This is major priapism. And when I discussed priapism before, I mentioned how it can lead to impotence if nothing is done. So priapism can affect a few of the people who have various disorders like leukemia, lymphoma, multiple myeloma, but the commonest occurrence is in people with sickle cell disorder.
Okay.
It happens more commonly with people with sickle cell disorder, particularly sickle cell anemia. People have hemoglobin excess.
Okay.
Young boys aged not more than 3 years can be affected. Then I'm going to the brain now. Brain, we all know strokes affect the brain of children. Some of the children have sickle cell disorder. Strokes affect the brain and may not only prevent physical movement of limbs, but also affect other brain functions. Stroke occurs when there is a significant interruption in the supply of blood to the relevant part of the brain, usually due to blood clots. There was a time I also discussed this extensively. We call it thrombosis, blood clots. When it blocks the arteries taking blood to the brain, it can have stroke. Or there may be bleeding from the arteries in the brain, blood loss, hemorrhage. This can also cause stroke. So in the general worldwide population, stroke mostly occurs in adults and hardly in children or even young adults. Unfortunately, for yet unknown reasons, strokes in persons with sickle cell disorder, that is mostly with HbSS, occur mostly in children aged 3 to 13 years. Hence, the introduction of transcranial Doppler ultrasound scan, which is available in the National Sickle Cell Center, Lagos. This ultrasound scan, in the layman's language, we say brain scan, is to detect sickle cell disorder children who are at high risk of developing strokes in order to provide them with stroke prevention therapy, such as hydroxyurea or monthly blood transfusion. I discussed transcranial Doppler about 2 or 3 weeks ago on this platform.
Okay.
So I've finished with the brain. Now I'm going to how it can affect eyes. How it does affect eyes, sickle cell disorder. Apart from a longer lifespan, people with hemoglobin SC disorder generally enjoy a better quality of life with far less frequent or severe crisis of pain or anemia SC is less severe than SS. You see some SC people, you won't even know they have sickle cell. They hardly have crisis. They are hardly ill. They enjoy that. But however, eye complications seem to affect persons with hemoglobin SC more than those with hemoglobin SS disorder. What happens in the eye is that the scar in the vitreous is the jelly-like fluid that covers everybody's eye. The vitreous area forms a string-like pattern, which becomes attached to the retina. So with recurrent bleeding and scarring, the string-like, that fibrous membrane, pulls on the retina and may have abnormal fragile vessel developing within the membrane. So this may lead to the detachment of the retina from the outer coat of the eye, further bleeding into the vitreous. The detached retina leads to sudden loss of vision associated with seeing flashes of light. Surgery is needed to restore vision. So all persons, I'm using this medium now to talk to all persons with sickle cell disorder, particularly those with hemoglobin SC, should have regular eye checkup at least once every year.
Oh, wow.
Those
Once every year.
Should rapidly see an eye doctor, which is the ophthalmologist. And also, I'm advising all children whose parents have hemoglobin AS. Let's say one parent has AS, another has AC. They should all have their genotype, hemoglobin genotype, routinely confirmed, because we have seen some SC, they will give them AS. They give them a wrong diagnosis. They should confirm it, because some of them do come with blindness before they are now diagnosed to have SC. If they are routinely diagnosed well from beginning, it can be prevented. That's blindness. Now, this is because I've said it, we have seen children who have a blindness. It is after they've come around to see doctor with blindness, because before the real hemoglobin diagnosis is made in a reputable lab, and we now discover that this child is SC and not the former hemoglobin genotype he was given, like AS or AA. It's always wrong diagnosis, very common. So it is good for whether you are SS, whether you are SC, it's good to check eyes at least once a year with the eye specialist. Then acute splenic sequestration. We are talking about the spleen now. This term is used to describe the collection of blood cells in a person's spleen. This leads to more severe or fatal anemia, which often requires blood transfusion. It is most common in young children with sickle cell anemia, HBSS, usually aged between 4 months and 5 years. It requires urgent blood transfusion, and future episodes can be prevented by daily use of oral hydroxyurea. Actually, when they come for genetic counseling, we teach parents how to feel for the spleen of their younger children. So that if the spleen is getting enlarged rapidly, they will quickly discover it and rush the child to see the doctor. That is why genetic counseling is very, very important. So it is common in young children with sickle cell anemia, HBSA, usually aged between 4 months and 5 years. Urgent blood transfusion required. They are also to be placed on hydroxyurea. This is why it is important they register under the hematology. Otherwise, the spleen should be surgically removed. Splenectomy can be done. After splenectomy, a lifelong oral penicillin, that is, taking penicillin V by mouth for a lifetime, the child is placed on penicillin G to prevent future bacterial infection. Now, it can also happen to the liver, acute liver sequestration or hepatic sequestration, we call it.
Okay.
This is much less common than splenic sequestration and is commoner in adults with sickle cell anemia. The liver is enlarged and painful. It should be treated with antibiotics, especially as surgical removal of the liver is inconceivable. It's inconceivably dangerous to remove the liver. So preventive treatment with hydroxyurea should also be introduced. You can see I'm mentioning hydroxyurea every time.
Yeah.
And hydroxyurea is a drug that you cannot just go and buy at the counter, be taking it on your own.
It has to be prescribed. I said
the gallbladder.
Okay.
The gallbladder is a small organ located behind the liver. It has several functions, and the formation of gallstones within it is commoner in persons with sickle cell disorder. This may lead to infection and to severe pain. Treatment with appropriate antibiotics and even surgical removal of the gallbladder are conceivable. I've actually seen a 38-year-old man who had this problem and the gallbladder was removed. The kidney stones filled the jam bottle of jam. The kidney stones filled it. So the gallbladder can be removed. Then I'm going to the bone now. The bones. I'm going to talk about the bones now, how it affects the bones also.
All right.
Painful we all know painful bone crises are very common in persons with sickle cell disorder. The definite cause is not well known.
Yeah.
But reduction of its frequency can be achieved with daily injection of appropriate dose of hydroxyurea. I've mentioned hydroxyurea again. Bacterial infection in bones, which is known as osteomyelitis, is also commoner in persons with sickle cell disorder. It should be identified early for treatment with appropriate antibiotics to be effective. If not, I've seen somebody with chronic osteomyelitis, that is infection of the bone, he has carried it for 11 years.
Wow.
Because he did not seek appropriate treatment for a long time until he came to meet us at the center. As God will have it, after the treatment, the bone healed up after 11 years. So it should be identified early for treatment with appropriate antibiotics to be effective. Otherwise, the osteomyelitis may become chronic and difficult to resolve without surgical intervention. Even the surgical intervention has its own disadvantages. Some bones, especially around the hips and shoulders, also become chronically painful and less functional owing to inadequate blood supply. This one is known as avascular necrosis. Avascular necrosis. And I'm going to elaborate now what is avascular necrosis. Avascular necrosis of the head of the femur. The head of the femur is the thigh bone, and of the head of the humerus. Humerus is the upper arm bone. It can occur in adolescents or adults. The head of the femur fits into the hip joint, while the head of the humerus fits into the shoulder joint. Avascular necrosis means the death of a bone caused by reduced or absent blood supply. It can occur when sickle red blood cells block the blood vessels, that is the arteries that carry blood to the head of the femur or humerus. The thigh bone is the femur. The upper arm bone is humerus.
We have run out of time, ma. We have run out of time. We're out of time completely.
You said what?
I said we are out of time completely.
What will happen? Let me rush.
We'll have to continue next week because obviously our time is fast spent. What we'll do is we'll continue next week from where we stopped, and we'll look at some of the other organs that you have not mentioned as well.
Okay, no problem.
Thank you very much. Okay, that's it for those people who are probably just joining us. So sorry you didn't catch up on that, but we have to go now, and that wraps it up on surviving sickle cell. We're talking about the organs that are really affected by sickle cell. Ladies and gentlemen, it's been fun doing this with you as usual. We'll be back here tomorrow.
Not tomorrow, next weekend. Next week Saturday.
Oh, better.
That's right.
I'll be back here on Monday, God willing. Stay out of trouble, be good to yourself. Follow the station across all platforms, IFM923 Lagos on Instagram. For Twitter, it's IFM923. And for Beatrice,
yes, I am Beatrice Inem on Twitter and Instagram.
For me, it's Colade Dominate. See you at 12.
Been a good one. Bye-bye.